Okay, good evening. So for today, I will be discussing about the integumentary system. This is the second to the last topic for the prelim grading period. So let us start our discussion. Okay. So the word integument, the word integument, no, is Latin, which means covering, because that is the main function of our integumentary system, okay? Covering, no, of the body. It consists not only of the skin, but also of the accessory structures, such as the hair, glands, and the nails. Okay? One important function of the integumentary system, no, especially in diagnostics or in health assessment, is that it can indicate physiological imbalances in the body just by examining the skin and most of it accessory organs. Okay? Doctors will be able to tell if there is something wrong, in the body just by the appearance of the skin, the appearance of the nails, the appearance of the hair. Okay, some tells something about the health, no, of a particular person. And the integumentary system serves primarily five functions. One is protection, second is mainly for sensation, third is for vitamin D production, four is for temperature regulation, and excretion. In terms of protection, as we have said, since the epidermis of the skin, during our discussion of the tissues, the epidermis of the skin is made up of stratified squamous epithelium. It provides protection against abrasion and against ultraviolet light. We will discuss the details of that later. Now, in terms of sensation, okay, the integumentary system has receptors that can detect temperatures such as heat and cold, that can detect touch, pressure, and pain. And that is why, in cases of burn injuries affecting a significant depth of the skin, when those sensory receptors are also damaged, as the burn tissue uh, heals into a scar, the scar formation becomes insensate, no, or has abnormal sensation because of the damage of those receptors. But then again, it depends on the depth of injury, no, sa burn injury. Ah, that is why later we will also be discussing how burn injury is classified according to depth. That is why, di ba, you have your first degree, second degree, and third degree burn injuries. We will be discussing that later. And then another important function of the integumentary system is for vitamin D production. Because when our skin is exposed to ultraviolet light, now, which comes from the sun, our skin produces a molecule that can be transformed into vitamin D. Ah, okay. So therefore, no, that molecule is not yet vitamin D. It has to be converted first into, no, an active vitamin D by two vital organs, and that is the liver and the kidney. So later, again, we will discuss the details of that. So this is just an overview. Number four, you have temperature regulation, because the amount of blood flow beneath the skin's surface, okay, is a big factor in dissipating the heat coming from our core body. Oh, di ba? As the blood flows through the surface of the body, no? Our warm blood or the temperature of our blood The warm temperature of the blood is dissipated towards the surface. Huh? And at the same time, the activities of the sweat glands in the skin both help regulate body temperature. When we perspire and when those perspiration or sweat evaporates, it tends to lower our body temperature. Now, the fifth function, which is excretion, is just a minor function of the skin because only a small amount of waste products no, are lost through the skin and in the gland secretions. Because majority of our excretions happens or comes from the kidneys and also from the gastrointestinal tract. Okay? So if you will look in this illustration, okay, actually this is very interesting because here in this drawing, you will be able to distinguish the two distinct layers of the skin, namely the epidermis and the dermis. Okay, so the epidermis is the most superficial layer of the skin. And as we have said in our discussion of tissues, it is made up of epithelial tissues. What specific type of epithelial tissue? Diba? That is stratified squamous epithelium, specifically keratinized. Diba? Because stratified squamous epithelium are classified as keratinized and non-keratinized. In the case of the epidermis, it is keratinized. Now, if the epidermis is made up of epithelial tissue, the dermis is made up of dense connective tissue. Huh? What specific type? Dense collagenous or dense regular collagenous connective tissue. Okay? Now, oh, the dermis, no? The dermis, beneath the dermis, sa ilalim pa ng dermis, there is another type of tissue which we call the subcutaneous tissue, which is no longer a part of the skin. The subcutaneous tissue is another connective tissue that attaches the skin to the underlying tissues pa, such as muscles, deep fascia. No? It is the subcutaneous tissue that attach that. And subcutaneous tissue is one type of loose connective tissue. Okay? And if you will look at this uh, at this drawing, no, you will notice that these epidermis can be subdivided into five distinct layers, okay, or five distinct strata. And usually, the cells on the deepest layer are the ones that perform mitosis, meaning they undergo continuous germination and mitosis, producing new younger cells. And as new younger cells are produced at the basal layer, the older cells are pushed in an upward direction, losing their nucleus. That is why, pagdating mo dito sa stratum granulosum, lucidum, and corneum, they begin to lose their nucleus and the shape becomes flat because they are being pushed in an upward direction. And as the new cells form at the bottom, they push older cells to the surface, as we have said earlier, where they slough or flake off. Okay? No? And that process of new cells being produced and old cells being pushed towards the surface is called keratinization. And let us name all of those five distinct layers of the epidermis. The topmost layer on the surface is called the stratum corneum, which possess the keratin, keratinized surface. no? Flat-ended cells. Ah? And then it is followed by stratum lucidum. It is followed by stratum granulosum. Okay? And it is followed by stratum spinosum. Then your stratum basale. Huwag pagpalit-palitin. No? Yung pangalan ng mga layers na yan. Hmm? Okay? Ah, just remember yung first letters. No? Corneum, C. No? Lucidum, L. No? You have granulosum G and spinosum S, and then basale, no? Letter B. Just remember the first letters and remember yung C, L, G, S, B. Hulugo, no? Hulugo. Hulugo sa batok. Ha? Hulugo sa batok. O, para madaling tandaan. C for stratum corneum, L for stratum lucidum, G for stratum granulosum, and S for stratum spinosum, P for stratum basale. Huh? Okay? Now, if there is excessive sloughing off, no, of the epidermis, specifically the stratum corneum, no, occurring on the scalp, and that is called dandruff. Diba? Tawag doon, dandruff. And if the skin is subjected to friction, the number of layers in the stratum corneum greatly increases. Therefore, no, it becomes thickened. No? Yung keratin becomes very, very thick, huh? Producing what you call a callus. Okay? Now, over a bony prominence, pwede rin namang yung stratum corneum can thicken also to form a cone-shaped structure. Hindi lang basta-basta kumakapal yung balat, but there is a cone-shaped structure thickening over bony prominences. It's called a corn. Kasi cone-shaped siya. Okay? Now, so let us go to the dermis. So we have just finished the characteristics of the epidermis. So tandaan niyo yan. So let us now go to the second layer of the skin, which is dermis. As we have said earlier, it is composed of dense collagenous connective tissue. What else? It also contains fibroblasts, adipocytes, and macrophages. Huh? Okay? And as you will see in this drawing, okay, nerves, hair follicles, smooth muscles, glands, and lymphatic vessels extend into the dermis. All of those structures that we have enumerated can be found into the dermis. And that is the reason why, as I have said earlier, burns that extends towards the dermis will damage those structures that we have just enumerated. What are those? Again, you have nerves, hair follicles, smooth muscles, glands, and lymphatic vessels. So aside from uh, the sensation being abnormal, no, losing the sensation because of the damage of the nerves, there is also this tendency, no, that hairs, no, will no longer grow on the burnt side, no, or side. Bakit? Ah, aside from nag-scar na ka siya, no, the hair follicles can also be damaged. If the burn injury extends down deep into the dermis. Ah, okay? Now, if you will look, no, at this drawing, if you will look at this drawing, no, okay, those lines represents the orientation, no, of those collagen fibers found in our dermis. Ha? Okay, yung mga collagen fibers in our dermis, some of those fibers are oriented in more direction than others. Okay? No? And therefore, because of the orientation of those collagen fibers, they form cleavage lines. Like for example, in our abdomen, oh, makikita nyo, the cleavage lines are oriented horizontally. So therefore, in our abdomen, most of the collagen fibers are oriented horizontally. And now what is the clinical significance of those tension lines or cleavage lines? Okay? Uh, it is of clinical importance among surgeons. Uh, because when surgeons do incisions uh, across, okay, across the tension lines, look at what happens doon sa suture. Ano pwedeng mangyari doon sa suture? Okay? The suture gaps. Buka siya. Pag bumuka yan, it will result into an increased scar formation during the process of healing as compared to when the incision is made along or parallel to the cleavage lines. Huh? It results to less gapping and also results to less scar tissues. Oh. And that is the reason why, di ba, during cesarean sections, no, or C-section, ha, okay, most, uh, di ba, we have two types of incisions sa cesarean section. One that is vertical, which is the commonly used, yung regular, and one that is horizontal, or yung kung patawagin nila bikini cut. So as you can see, no? Oh, yung bikini cut, no, produces less scar formation because it is or it follows, no, the orientation of the tension of cleavage lines abdomen, as compared to the vertical incision. So that is the clinical significance of those tension or cleavage lines. Now, let's go back here. If you will look at the superior surface of the dermis, you have, no, projections or upward projections. These upward projections na parang maliliit na hills, no, okay, are called the dermal papillae. And as I said earlier, these are projections towards the epidermis, no? And they are found in the upper part of the dermis. As you can see in the drawing, the dermal papillae contains numerous blood vessels, meaning arteries and veins. Okay? And ang kaibahan niyan, no, itong drawing na yan, it represents, no, most parts of the body, meaning sa chest natin, sa forehead natin, sa face natin, sa back, no, skin natin, sa forearm natin. That is how, no, yung papillae, no, or the dermal papillae are arranged. No? In the palms of the hands and in the soles of the feet, especially at the tips of the digits, okay, the dermal papillae are arranged in parallel curving ridges that shape the overlying epidermis also. Ibig sabihin, nagre-reflect siya hanggang sa ibabaw. Yung epidermis may alun-alun din. Ha? Kapag sa tip of the fingers. So therefore, those curving ridges that shape the overlying epidermis forms into fingerprints and footprints. That is the reason why we have fingerprints. It's because of the dermal papillae. Now, okay, let's go to skin color. No? Why do we have to discuss skin color? Because skin appearance or skin color, okay, also most of the time tells something about the health status of a particular patient. Okay, and there are three main factors no, that determine the skin color of an individual. And that includes number one, the pigments present in the skin. Number two, blood circulating through the skin. And number three, the thickness of the stratum corneum. Let's first discuss the pigments. Pigments muna tayo. There are two primary normally occurring pigments in our epidermis. One is melanin and the other one is carotene. Huh? Melanin is a dark pigment, dark group of pigments. It is primarily responsible for the color of our skin, the color of our hair, and the color of our eye. That is why different races have different skin colors, different hair colors, and different eye colors. Because different races have different concentration of melanin in those parts. Uh, at syempre, no? Yung mga white race, no? Mga puti. Actually, yung puti, yung mga puti, may tatlong classification pa yan, di ba? Yung redhead, no? uh, blonde, at saka brunette, depending on their hair colors. Di ba? Yung brunette, yung redhead, medyo mapula-pula yung buhok, no? Pero puti pa rin yung kulay ng skin. Ha? Yung blonde, medyo mas light, mas maputi yung kulay ng buhok. At puti rin ang balat. And then you have your brunette. At sila yung mga maiitim ang buhok, pero maputi pa rin yung balat. No? Usually sa mga Americans and Europeans. Di ba? Okay? So later we will be discussing the function of melanin. Ha? Next is carotene. Carotene is a yellow pigment found in plants such as squash and carrots. Kaya pala yun ang kulay ng kalabasang hinog, no? At saka ng carrots. It is because they are rich in carotene. One specific type of carotene is beta-carotene. Yun talaga yung nakukuha sa squash and carrots. And beta-carotene is a precursor for the synthesis of vitamin A. Okay? Now, so let's go back to melanin. No? Most melanin molecules are brown to black pigments, but some are also yellowish or reddish. Melanin is produced by the melanocytes, no, present at our stratum basale. The stratum basale in the epidermis. Again, they are produced by the melanocytes. Ito yung kulay green yan, no, melanocytes. And then they are packaged into vesicles that are called melanosomes. As you can see in here in your drawing, no? After being produced, yung mga melanocytes, they are packaged into those vesicles called melanosomes. Now, the epithelial cells phagocytize the tips of the melanocytes cell process. Thereby, they acquire, as you can see, the melanosomes. And as they acquire the melanosomes, hindi napasok na ngayon sa loob nila yung content ng melanosomes na melanin, depositing pigments into the skin, making it to appear darker. And what is the main purpose of melanin? It produces protection against ultraviolet light from the sun. So therefore, since ang function ng melanin is for protection, the darker your skin is, meaning the more protected you are against ultraviolet lights. Di ba? Kasi yun pala purpose ng protection. Kaya yung mga mas maiitim, mas less ang chances to develop skin cancer as compared to those who are on the white race, kumbaga. Okay? It is also melanin that is responsible for freckle or mole formation in some regions of the body. What is the difference between a freckle, no, and a mole? Unang-una, ang mole kasi bilog na bilog yan. No? Ang freckle pwede kasing irregular. No? Ang shape ng freckles. Okay? And melanin production can be determined by genetic factors, exposure to light, and hormones. As I've said earlier, okay, the more you are exposed to sunlight, the more that you secrete more melanin, no, from your melanocytes. Okay? Genetic factor meaning it has something to do with race, no? Or yung lahi. Ha? No? So, and also hormones. There are hormones, no, that causes darkening of the skin, especially sa mga babae, lalo na kapag ka nagbubuntis. No? May mga time na umiitim ang leeg, umiitim ang kilikili, because there are several hormones, no, pregnancy hormone that actually affect the secretion of melanin in our epidermis. Huh? And since all races have about the same number of melanocytes, racial variation in skin color are basically determined by the amount, kind, and distribution of melanin. Exposure to ultraviolet light, no, that is present in sunlight, masasabi ko lang kanina, will stimulate melanocytes to increase melanin production. And therefore, the result is suntan. No? Meaning, nagtan ka, umitim ka. Ha? Okay? No? And we are actually fortunate, no, Filipinos, to belong to the brown race because, no, since we are in the brown race, di ba? The tanning, no, the resulting tan when we are exposed to sunlight, no, is more on homogeneous or even, as compared to those belong to the white race, yung mga blonde na yan, yung mga redhead na yan, there is a big chance na instead of the even distribution of uh, um, of melanin, no, in the skin, no, they tend to develop, no, spots where there is higher concentration of melanin. At ang tawag doon is, ano nga bang tawag doon? Freckles, kasasabi lang natin kanina. Di ba? Kaya mas common ng freckles sa mga mistisa. Di ba? Okay? So, okay. Although many genes, no, are responsible for skin color, okay, mutations, no, okay, of a gene, no, responsible for the production of melanin can actually prevent its production. Siyempre, if melanin, no, is not produced, no, by those epithelial cells, then it will result to a very light, no, or fair skin complexion, ha? Okay, no? Pati yung buhok, ha? Walang melanin. So therefore, puting-puti pati buhok, pati kilay, pati pilik mata, pati yung buhok sa katawan. That condition is called albinism. No? I don't know if you're already familiar with this condition also, yung vitiligo, no? You can look it up, ha, sa internet kung ano yung vitiligo. Vitiligo is a condition, no, of the skin wherein vitiligo, okay, no? A condition of the skin wherein, no, there are only areas where melanin, no, becomes absent. Kaya may mga patsi-patsi, no, in the area of the skin that appears to be white as compared to the adjacent skin. Kaya makita mo uneven yung skin color of those people with vitiligo. Commonly starting around the mouth or kaya naman commonly starting on the hand, no? paakyat siya. Ang tawag doon, vitiligo. Okay? Now, so nandun na tayo sa pigment, no? Natapos na natin yung first pigment, which is melatonin. Another pigment, no, that can be present in our skin, particularly in the epidermis, is carotene, which is a lipid soluble substance that we get from yellowish vegetables such as sabi nga natin kanina, squash, no? Carrot. And since this is lipid soluble, ayan, when consumed, especially in large amounts, it accumulates in the lipids of the stratum corneum and in the deposits of the dermis and subcutaneous tissue. And again, when consumed in large amounts, the skin can become quite yellowish. Pero that's not, no? Ano tawag dito? That's not something to worry about. It will normally happen, especially dun sa mga mapuputi. Yan, na mahilig kumain ng kalabasa, ng carrots. No? It can actually produce a yellowish tint in your skin. But it does not mean, kasi di ba we have a connotation, if someone turns yellowish, ang iniisip agad ng mga tao is jaundice. No? That's also yellow discoloration of the skin. But it is not a normal variant. Pag sinabi mong jaundice, okay, it is the yellowish discoloration of the skin, usually due to jaundice. One word lang yan. Usually due to damage of the liver. Pagdating natin dyan sa digestive system, sa midterm, we will be discussing why skin of a person with liver problem develops jaundice, or the yellow discoloration of the skin. Okay? Now, the color of the blood, circulating in the dermis also contributes to our skin color. A decrease in blood flow, such as occurs in cases of shock, can make your skin appear pale or yung namumutla sa Tagalog. Di ba? Kasi, like for example, for those who experience COCC training, di ba? Most of the time, kapag ka tumayo ka ng matagal without moving, the blood pools in your lower extremities. Okay? And when your blood pools in your lower extremity, very, very small amount of blood is left circulating in the upper body. Yung itsura ng pasyente or nung COCC trainee, bago siya himatayin, bago siya mag-collapse, putlang-putla na. It's because of decreased blood flow. Okay? Now, there is another discoloration of the skin that can also tell the general health of the patient. And that is called cyanosis. Ano ba itong cyanosis? Hindi lang siya basta-basta pale. There is already bluish discoloration of the skin. Because the problem is not in the blood flow, but rather the blood oxygen content. If the blood oxygen content drops, then it results to cyanosis or the bluish discoloration of the skin. And one very good example of a patient who is prone to cyanosis are the blue babies. Siguro naman hindi niyo first time narinig yung blue baby. They are called blue baby because the primary manifestation of their disorder, and it is most of the time a congenital heart disorder, yung butas sa puso. Butas that separates the left and the right ventricles of the heart. Siyempre, pagka may butas, nagkakaroon ka ng abnormality sa hemodynamics and there is this tendency for the oxygenated and unoxygenated uh, blood in our heart mixes. Yun ngayon yung nagkukos ng cyanosis. Okay? Okay, so stop ko muna dito. I will be continuing the recording in the part 2 of my discussion. Para mas madaling i-upload sa internet. Wait lang.